Given all that we've done, various inputs, but then now 3 hours of conversation and more over lunch and whatnot, how is your thinking evolving in your group, either in terms of the specific approaches or some of the ideas, maybe some of the detail? Whatever it is you want to talk about, how is it evolving? And I'll give you about 15 minutes for that, and then really we'll invite headlines if anyone wants to share it. Not sort of 5-minute presentations, but if you've got 30 seconds to feed something back, then we'd certainly like to hear it. But there's no requirement to do so. So if you feel, you know, my souffle is still cooking, I'm not very good at souffles, but you know, it's still sort of getting ready, then you don't need to feed anything back. But if you do, there'll be an opportunity for sort of 30 seconds or a minute in 15 minutes' time. Okay, so over to you to discuss this question. Great, thank you very much. So for a few minutes, if there are any, what I would call headlines, so literally if you've got a minute, maybe 2 minutes max, you know my style, I'll get gradually closer and closer to you if things go on. So just for literally a minute or two, what are your headlines on this question? What's evolving in the group's thinking and approach? I see Steve, you jumped up with alacrity here to get your voice heard. So there's a minute for you.
This is the first time I'm grabbing the mic other than yesterday. I'll try not to do it again in the next 24 hours, but if you'll just give me a second. As a clinician, I mentioned yesterday that you know, some things to me just seem to make sense. And one of the things that I've found with my time here is really I've developed a great deal of respect for the people in this room. I didn't know most of you when I got here yesterday, but I've had conversations with a lot of you, if not most of you, over the last 24 hours, and I've developed a great deal of respect for your passion and your willingness to work with what I think is an incredibly rich but also challenging group of people. I also have developed a respect for the Beck family for what they're trying to do. But I've also heard that what we're trying to do is collective impact and not isolated impact. I've heard that we want to do transformational change, but that we're not there yet. I've also heard that community engagement is important and relevant, but as is schools. I've also heard that we want to have a legacy, which means that we have some sustainability, that we build in advocacy and we build in awareness to whatever we do. And that there has to be opportunities down the road for funders and governments and nonprofits to jump into whatever we do. We've also heard about research being best practice and evidence-based, an opportunity to improve outcomes. And finally, and most importantly, we've been challenged by youth and families to unleash the noise and also to force the issue, right? So one of the questions I had, and I've had lots of conversations with folks here, is whether or not we need to maybe slightly change the approach and request from the Beck family and CIHR to think about something. Just a little proposal. $12 million from the Beck family, $12.5 million is a great deal of money. What we've got on the table right now, broken up, parceled up may not seem like a lot of money, but I think for youth mental health, this could potentially be a crossroads. And I think that there's potential to leverage the money from the Beck family to do a lot more than just what's on the table from the Beck family. And I also think that there's a lot of people across the country who'd be interested in contributing to that fund. We've talked about systems change and the importance of systems change, and I think that what we saw with the Headspace model resonated with a lot of people. It resonated with me because I really think there's an opportunity to bring existing services together under one roof, to break the silos and to actually make a difference for the youth in the community when people start to work together and provide an approach that doesn't exist right now. And I've heard that this is a problem across the country. So what I'm proposing is this, just over dinner, and before Ross takes the microphone away from me, is to think about whether or not there is an opportunity to take the money that the Beck family is putting up and to leverage that across the country to create a chain of nodes, a chain of headspaces, not with new services, but with existing services, and to use the money for systems change, kind of like what's been done in New Brunswick, so that these centers would have a catchment areas of schools, they would have catchment area of youth both vulnerable youth and youth that live in socioeconomically challenged areas, and that the rest of the money, the funding from CIHR, would be reserved for research, for new research, and for interventions that need to be tested. And that in so doing, we would create a national platform. We would create a national youth strategy, and that we would actually have something to hang our hats into. Because my concern about the way things are going right now is that this could become more divisive than bringing people together. And I would hate to see that, because I really, really think that people in this room need to continue to work together in the spirit of true collaboration, of a collective impact. I would just ask that we think about maybe a plan B. Thank you.
Thank you, Steve. A lot of food for thought over dinner and tomorrow, no doubt. Yeah, thank you. Anyone else who wants to share a headline, particularly on this question?
Were you asking me to respond to that particular comment? No.
On the question on the screen, yeah.
Yes, yeah. Thank you. So, although one aspect of our thinking, so at the end of the day yesterday, having made a pitch that we were a particular group as described, but we were interested in being part of a broader approach than we're the psychosis AYP group, so we have a good group of researchers, policy, family, and it's quite national, but it's narrow. So I mentioned that yesterday. So at the end of the day, we focused on, well, what are the sort of underlying principles of this approach that we would look for in other groups to see how they fitted as an approach. So we articulated a list of things that's in a bit of a scruffy list here, and in no particular order. One is that we were operate with policy and at a provincial level, which I'm not sure that a one-size-fits-all approach works terribly well in Canada. And part of the discussions is how you have to adapt to, at one level you adapt to each area while having evidence-based practices. So that's a bit of a comment on the last suggestion. The other issues that we had were some things maybe very simple, but a recovery orientation. We engaged policy people. We took a population-based approach for service delivery, so building on the epidemiology, and you need epidemiologists involved, and that services need to be seen to serve the whole population, and you can build that into pilot projects, that they should have a focus on access, evidence-based practices, family engagement, both in care and in research, developing the research agenda, that there should be public and family education, and there needs to be a practical case management approach, which is a sort of generic thing that fits across all disorders. Thank you.
Thank you. Okay. Anyone else? I'll probably, just conscious of the time, and again, given that we've got to run into dinner, I'll probably manage 2 or 3. So if we can manage more, if we can keep them really succinct. And again, if you can say who you are.
Yeah, I've got some notes here. So we've had a really great conversation this afternoon. I think some of us started it last night. And Chris Whalen, I'm with a small team from New Brunswick here. But we've been talking to Bill and Patty and their network, and so basically I think we are counting up sort of 7 teams and 2 networks in this conversation. But our approach was very much similar to yours in the last intervention, that we just wanted to sort of, we all want to be part of something that is transformational. We want to be part of it. We started with a focus on what we heard from a number of the teams yesterday afternoon was a focus on Canadian children who are most vulnerable in terms of their experience of mental illness. And so we recognize that was a priority of action, certainly for Canadian First Nations children experiencing mental illness, but street endangered youth, LGBTQ, newcomer youth, youth with an experience of multiple systems, youth in care, youth in custody. So that's a lot of the conversation that we've been having. And we recognize that if we want to focus on that clientele, we really need a transformation that is going to engage all systems that intervene with those children and youth. And so we really need an integrated approach. And so we talked about sort of core values around integrated service, a rights-based approach, inclusiveness, not only in terms of diagnostic, but social difference, diversity. We talked about a holistic approach that is very much child and youth and family voice empowered, interventions that are strength-based, ensuring that there's access to mental health services where and how youth need to access those services. So very encouraged by the presentation this morning and the Headspace initiative. And so that was the conversation sort of through the latter part of the afternoon. And then we got into a broader conversation. And maybe, Bill, you want to speak to that?
Having dropped in and out of the conversations, there's been a lot of them today, but I'll mention a few that I heard here, common ground across the two teams and 6 or 7 networks. Sorry, 2 networks and 5 or 6 teams. I could be losing it this time of day. There's the thing that struck me was a paradigm shift for everyone across wherever you work. So a different way to look at youth as inclusive, not marginalizing through our services, but actually seeing youth fully in terms of not just complexity of risk, but in terms of potential, strengths, resiliency as well. So paradigm shifts for us all to make transformative change, to be on the same page. Service integration. But even more than just integrating services is how we deliver those services outbound, accessible to youth, in places with youth are, school-based, community-based, ability to provide interventions where we don't refer again and refer again and refer again, but where we have opportunity to perhaps step up interventions, but also reduce intervention and maintain connectedness with communities. And the other thing was here, recognition across the group here was recognition of diverse contexts, that there are probably common principles of practice and integration that can apply to a diversity of contexts, which gives a sense of richness in various places. And we even had the idea that there may be on a center of excellence level nationally where you could have common tools for screening, you could have common tools for integration, you could have common tools for how teams work together, especially when we're talking about multidisciplinary teams, interprofessional teams. There may be those kinds of practices that could be brought together with a level of accountability, standards of practice that could be encouraged across the board, so we begin moving in a transformative way nationally. I don't know. Am I missing something? Here.
I'll make it quick. I guess the only thing that I would say is that for any of us who work in Indigenous communities, none of this can be decided at this point. The protocol is that we go back. So anything that you're deciding that you're going to do and engage, that the protocol and CIHR and the Tri-Council guidelines will say that you go back and you will vet it through the communities. It's still kind of a backwards approach of doing it because really, in some ways, there's certain stakeholders that possibly could have been here that aren't here, that could have been engaged at this process, and you know, we have a bit of representation, but not a lot. The other thing is that in terms of mental health for youth and addictions, that particularly in addictions for youth, Indigenous people have led the country in terms of addiction models and treatment that I think other people could learn from. The ways in which they have done that and are currently doing it across the country. And so I would encourage people not just to see our population as a population that needs to have things done for, but actually that there are some really interesting models. I think of the Sturgeon Lake White Buffalo Youth Treatment Center, which is amazing for young girls. Absolutely incredible outcomes. So there are these models, so that we shouldn't be thought of as a population that needs stuff to be done, but actually those models are there, and they're very relevant, I think, beyond just the Indigenous context. Thank you.
Thank you very much. Wonderful. Thanks. Good. Quick scan round. Thank you very much. Well, plenty of food for thought, and clearly a lot's happened in the last 2 or 3 hours. Thinking's moved on a lot, and I really appreciate the time and the effort that you've put into that. Encourage you to keep doing it over dinner. If you've got any mental capacity left at all, then do, or range onto something totally different and freshen yourself up for tomorrow, because we're going to be back here in the morning. Still more to do, I guess, still more conversations to have.